Good evening. Today I want to talk a few minutes about toxoplasmosis. Toxoplasmosis is caused by a protozoan parasite, Toxoplasma gondii. In most people, they cause just asymptomatic infection, but in certain groups of people, especially the pregnant patients, they can cause congenital toxoplasmosis in the infants. So we are going to discuss this problem today. In 1 to 2%, they can result in very severe problems like chorioretinitis. Now, the definitive host for Toxoplasma gondii is cat, the domestic cat. They pass the oocysts in their feces, and human infection is acquired by consuming the cysts in cooked or undercooked meat or vegetables. And when we ingest those oocysts from these undercooked vegetables, we get the infection. Now, that's why we encourage pregnant females not to change the cat litter, because when they change the cat litter, they are exposing themselves to toxoplasmosis. Now, in the United States, the incidence is actually very low, like 0.1 to 0.1%, but in some countries in Europe and Latin America, the incidence is very, very high. That's why we encourage people to take all the precautions, especially not going to these countries where the incidence is very, very high, especially when women are pregnant. So that's an important thing we need to remember. The maternal infection, it might happen at any time from first trimester to the third trimester, but the rate is high in the third trimester. But remember, the fatal death or the serious effects of the infection are more severe when the infection happens in the first trimester. Now, 90% of children, when they are born, they don't have any symptoms. So it is asymptomatic at birth in like 90%, but symptoms like fever or maculopapular rash, hepatosplenomegaly, microcephaly, the small head, the seizures and jaundice, thrombocytopenia, and rarely even generalized lymphadenopathy can be seen in these patients. There is a classic triad of toxoplasmosis consisting of chorioretinitis, hydrocephalus, and intracranial calcifications. Those are that is the triad, the classic triad. So that is important to remember. The chorioretinitis, hydrocephalus, and intracranial calcifications. The most common late effect is chorioretinitis, but even mental retardation, spasticity, they are also commonly seen in these patients. Now, diagnosis. There are many tests to diagnose toxoplasmosis, and their sensitivity and specificity varies widely. Now, the choice of the test depends primarily upon whether prenatal or antenatal testing is being attempted. For example, in postnatal diagnosis, in symptomatic infants, the diagnosis of congenital toxoplasmosis may be strongly suggested by history and physical examination. Need to do ophthalmologic exam and auditory exam and a neurologic exam, and sometimes when they are symptomatic, you should do lumbar puncture and CT scanning, computed tomography of the head, in order to diagnose this infection. And you should remember other torch infections. You see, toxoplasmosis is one of the torch infections. You need to remember other torch infections when you're diagnosing this condition, because all of them, they present similarly. So you can identify, you can isolate this from placenta or umbilical cord or fetal blood, and the most sensitive test is PCR, polymerase chain reaction. So polymerase chain reaction is very helpful. It has the highest sensitivity to diagnose toxoplasmosis in the postnatal time. Now, what about prenatal diagnosis? The same thing. The sensitivity and specificity, it varies widely, and the serology and maternal serum clinically has been performed. We take a maternal serum and you test for IgG or IgM or IgA antibodies, and you take amniotic fluid and test for IgM or IgA antibodies, and you take fetal blood and you test. So all of these tests have varying sensitivity and specificities, but the best test again is PCR testing, polymerase chain reaction. Now, what about the prevention of side effects? There are three medications you need to remember here. Number one, spiramycin. Spiramycin, the treatment appears to reduce the likelihood of congenital toxoplasmosis by as much as 50%. Treatment of primary Toxoplasma gondii infection is recommended for pregnant women with human immunodeficiency virus, HIV. So if the patient has HIV, certainly you should use spiramycin, because that congenital infection, it's the rate of congenital infection is reduced dramatically with spiramycin. The other medications are pyrimethamine and sulfadiazine combination. This medication is a folinic acid antagonist. That's why you should leucovorin. Leucovorin, which is folinic acid, it actually decreases the effects of these anti-folinic acid effects on these patients. So that's an important point. So you need to remember those medications: spiramycin and pyrimethamine sulfadiazine combination. And there are no studies which have showed the efficacy of any one of them. They are not superior to each other. They are just the same. So the long-term morbidity can be reduced with these medications. So chorioretinitis, seizures, severe psychomotor retardation, all of them have reduced by using these medications. I hope that helps, and if you have any important points, please send them to me or post in our web page. Okay, thank you very much. Have a good day.